welcome to all of you watching. I'm Julia Seeger, and this is Tech24. In this edition, we'll cross over to Dr. Shrikant Raje, the head of a medical facility near Mumbai. He'll tell us how his hospital is now also using oxygen concentrators as an alternative to liquid medical oxygen. This as the country battles a deadly second wave of the Covid-19 pandemic. And we'll talk about NFC, or near-field communication. You probably already use it to pay for things and take public transport, but it has a lot of other uses as well, from fighting fires in China to waking you up in the morning. Amid a crippling shortage of oxygen in several states across India, the government has set up a train to help deliver the life-saving gas. Dubbed the Oxygen Express, it's traveling through some of the most hard-hit areas, carrying tankers of liquefied medical oxygen. Well, to talk more about the difficult situation facing India, let's now cross over to Dr. Shrikant Raje, radiologist and head of a hospital in Hyderabad. Thanks for joining us.
Thank you so much.
So your hospital has a capacity of 110 beds, 50% of which are for COVID cases. You're now using oxygen concentrators. What are they exactly? And tell us more about your plan to set up an oxygen plant within the hospital.
Looking at the oxygen concentrators, we have 20 oxygen concentrators, which are good enough for ordinary type of patients. Those who are losing their oxygen saturation is between, say, 85 to 90. So those type of patients, we give oxygen concentrator. Oxygen concentrator is a unit which converts air directly into oxygen, and it is just dependent on electricity. It converts, it filters out nitrogen from air and converts it into, isolate the oxygen, and it gives oxygen through nasal cannula or BiPAP machine. So this is a very good stopgap arrangement when the oxygen supply is at low from the main central location. And post recovery also, patient can take away this oxygen concentrator at their home, and they can get this oxygen. The flow rate in this oxygen concentrator is 5 liters per minute to 10 liters per minute. So this is not a very high flow like a ICCU setup or like a jumbo cylinder. Regarding oxygen plant, there is something called as a PSA, pressure swing adsorption technology, where the oxygen from the air is directly converted into air oxygen in the plant within the hospital premises.
Now, could you tell us more about the so-called oxygen chain? What doctors are using to treat patients in general is liquid medical oxygen, meaning that the oxygen has to be liquefied to travel. What are the challenges in transporting oxygen?
A major source of oxygen creation in India is liquefied cryogenic technology. Big companies like Inox and Lind company, they have a very large network. They have totally 1,200 tankers and 800 nitrogen tankers also they are going to convert into oxygen tankers. This is a plant which produces a very large amount of oxygen in a liquefied way. They just take the oxygen from the air, liquidate it along with other gases, and then separate oxygen from it in the liquid form, and they put it into the tanker at minus 180 degrees Celsius, which is a cryogenic technology. And these tankers, they travel through aeroplanes or through the trains. We have express trains. 5 to 10 tankers are loaded on the train. Then these tankers arrive at the dealer's place. This oxygen is converted from liquid into air, and various hospitals take their jumbo cylinders to these sources. They put this oxygen into their cylinders, and thus it is sent to the various hospitals.
Dr. Shrikant Raje, thank you very much indeed for that. And it's time to welcome our tech editor, Peter O'Brien. Hello, Peter.
Hello, Julia.
We're going to stay in India, keep on talking about this difficult situation that the country and the entire continent is actually facing. Many innovators are actually coming up with ideas that are helping mitigate the crisis.
Yeah, that's right. India is exceptional at low-cost innovation, and battling the pandemic is no different. So, for instance, 2 students from the Kanpur Institute of Technology led a team which in just 90 days developed a low-cost ventilator generator called the Knockark V310. Now there it is. Its components are solely made in India, so it costs just 800 euros rather than several thousand. Now in the southern state of Telangana, local authorities have been using drones developed by the startup Marat Drone Tech. You can see it here. And what this does is this patrols the streets and allows them to see if any crowds are forming, and if they are, they'll use the loudspeaker which is attached to the drone to announce to people, hey, split up, you're getting too close. Over in Chennai, the Madras Institute of Technology has developed a portable hospital unit which can be set up by just 4 people in under 2 hours. It's got ventilation, it's got electrics, it's got a doctor's office, a ward, as you can see. It's even got an ICU which has negative pressure to stop the virus from flowing outside.
Great examples of frugal innovation in India. We're now going to go to Silicon Valley, where big tech is also coming forward to help India.
Yeah, that's right. So Google, for instance, has pledged 12 million euros in ad grants for public health campaigns. This means that local health authorities can use ads for free to inform people about vaccines and tests and that kind of thing. Amazon's also lending a helping hand. They've pledged 8,000 oxygen concentrators and 500 breathing aid machines to be sent over from Singapore to hospitals in India, while the Chinese electronics giant Xiaomi has also pledged 1,000 oxygen concentrators itself.
Now, meanwhile, Peter, IT companies have had to create war rooms. What's that all about?
Yeah, so of course many workers are calling in sick or they're taking time off to care for their sick relatives, and this means that many of India's huge technology service providers, so companies like Accenture, like Infosys and Wipro, have had to set up war rooms. So these are people manning the phones and the computers to make sure their sick staff have hospital beds or oxygen or medicine where available, but also to figure out how to maintain their services for their clients, who include many of the world's biggest financial firms. So with the shortage of staff that's going on, it's no wonder that teams are having to work 13 to 14 hours a day, a lot of them working from home.
Thank you very much, Peter. We're going to move on now to a whole other story. In China, big data is helping firefighters in the southern city of Guiyang predict risks and prevent fire hazards. Near-field communication chips were installed in hundreds of facilities across town, such as public hospitals and conference centers, making it possible to monitor temperature, electricity current, and voltage in real time. Monte Francis has this report.
Chinese researchers say that it's technology that can save lives. A system of sensors, monitoring systems, and cameras spread throughout the city of Guiyang to enable firefighters to pinpoint their response to a blaze and other emergencies.
There are some areas with hidden risks that our fire department should pay attention to. That includes water, electricity, gas, and fire exits. We have set up sensors and corresponding electronic devices, which are able to do a 24-hour monitoring.
Devices called near-field communication chips were installed in hundreds of facilities to monitor temperature, electricity current, and voltage in real time, along with 465 cameras installed across the city. Officials say last April they were able to prevent a fire when they detected high temperatures in an electrical system at a local hospital. But the widespread monitoring comes with privacy concerns and is part of a larger plan by China's ruling Communist Party to harness the Internet of Things, a vast network of electronic devices, software, and information. Those behind it defend its expansion.
We call it the big data exchange. We try to make the different companies and to exchange their ideas and to exchange their business and also to exchange their applications.
China is not the only country using the technology, but the government is taking steps far beyond any other nation, investing the equivalent of tens of billions of euros into a 5-year effort to make the country a self-reliant technology power.
And moving on now to Test 24. As we've seen, near-field communication has a variety of uses for professionals, but for consumers, it's mainly used for contactless payments and public transport. But Peter here has another potential use of NFC to show us. What is it?
Yeah, that's right. NFC didn't really become the big new way of interacting with the world that some people thought it might in the early 2000s when it first came about, but companies are still trying to flog various NFC gizmos, and I've got one here. This is Tapco, and what it is it's essentially a digital business card, so you can stick it on the back of your phone and someone else can come along with their phone, they can tap to scan it, and it comes up with all of your various contact details and social media information, all of that. My kind of reasoning is, well, if you both got your phones there, why can't you just send a text? But maybe I'm old-fashioned.
Or exactly, or use Bluetooth or something.
Yeah.
So maybe another more convenient way would have to be able to put it elsewhere than on your phone.
Yeah, of course. Yeah, you can keep it on anything. You can put it on a wallet, or you can even stick it on your forehead if you really wanted to.
Right.
That's what's clever about these tiny chips, is that NFC chips are essentially small computer chips, and they only begin to turn on and start working when they're in the field of a NFC transmitter. So say one on a smartphone, and nearly all smartphones have NFC transmitters on them now. So when it comes close to one of those, it will power on, it will save a bit of data, or it will blurt out the bit of data that's already saved onto it.
And what can you actually do with a little piece of data?
Yeah, so you can do a lot, and you don't necessarily need to have a branded one. You can get ones for very cheap online. You can do all sorts of things with them because you can program them how you want with various free apps. So for instance, you can use it in your car. If you've got a holster to put your phone in, you can have an NFC sticker there, and when you put your phone down, it will launch the apps, the map apps and Bluetooth, for instance, or you can set one by the side of your bed, and if you put your phone down, it can set an alarm, it can turn your phone screen off, it can put your phone on silent. So the uses are really endless.
Right.
It just depends on how smart your home is and your general surroundings are.
Right, so NFCs do still have a bright future. Thank you very much for that, Peter. It brings us to the end of this week's edition of Tech 24. We hope you enjoyed it, and we'll see you soon.